Meet Charlie. Just like you, his body is full of muscles. Whether they're big or small, your muscles are what help you do all of your daily activities, like jumping, swimming, riding, eating, and even smiling. Your muscles are responsible for things that you don't think about, too. They make your heart beat or help your lungs contract and expand so that you can breathe. For boys with Duchenne muscular dystrophy, activities that use their muscles can be hard. Because of a mutation in their DNA, boys with DMD are missing an important component in their muscle fibers called dystrophin. Without dystrophin, muscles are more easily damaged when being used, and so can be much weaker than the muscles of other kids their age. At first, they may just have a hard time running or walking long distances, or get tired more quickly than others. But as they get older, DMD will eventually affect all of their muscles, including the ones around their lungs and heart. This can be dangerous. If you have DMD, you and your family are encouraged to go to your doctor for special tests that help make sure your heart and lung muscles are still working all right. For lung checks, called pulmonary function testing, it is recommended that you get checked at least once a year while you are still able to walk, and every 6 months after that ability is lost. Sometimes going to the doctor can be scary when we don't know what will happen. So we are going to take a look at some kinds of lung tests so that you know what to expect and you can be a DMD hero. Your doctor's goal is to measure how strong your muscles are. For your arm muscle, that's easy. You can flex it, measure its size, see how much it grows, or count how many weights you can hold. While we can't measure how strong your lungs are by seeing how much weight they can hold, doctors have lots of other ideas. The most common type of pulmonary function testing is called spirometry. Spirometry measures the amount of air entering and leaving the lungs in order to identify patterns associated with different breathing complications. Taking a spirometric test is as easy as blowing into a straw. Your doctor, specifically called a pulmonologist, will hand you a mouthpiece connected to equipment which will measure quantities like volume and flow. Volume involves several separate measurements, all of which deal with how much air you can move in and out of your lungs. Inhale capacity is the maximum volume that can be inhaled. Expiratory reserve volume is the most air that you can breathe out. And functional residual capacity is the amount of air left in lungs after a regular breath. Flow measures how fast the air moves out of your lungs. It's a determination of how open your airways are. Other pulmonary function tests may have other ways of measuring the health of your lung muscles. For example, your pulmonologist may want to see how hard you can blow, how strongly you can cough, or how hard you can suck in a breath. Sometimes, the weird types of breathing required by these tests can become tiresome or frustrating. Make sure to take a break and rest in between tests so that you are at your best. One more measurement that's good to know is called the forced vital capacity. Like the other tests, it measures how much air you're moving through your lungs, but this one specifically measures the most air that you can breathe out after taking the deepest breath you possibly can. Measuring these quantities over time can help you and your pulmonologist keep track of how well your lungs are functioning and keep a close eye on your respiratory ability. This can help you keep you safe and prevent complications. If you notice any difference in your ability to breathe, you should contact your doctor right away. Even something as normal as a cough can become problematic for DMD patients. Ask your doctor or physical therapist to help you and your family know what kinds of complications and signs to watch out for, as well as how to help you breathe more easily, like with cough assistance. Hopefully, this video has helped you understand how Duchenne muscular dystrophy affects your lung muscles in particular, and to feel comfortable with the types of lung tests you may have at your doctor. These tests will help you stay happy, healthy, and hopefully breathe easier.